Good morning. I'm Elizabeth Stadina, Vice President of Data and Analytics at DartmouthHitchcock Health. Today, I'm going to share with you some of our struggles as an organization with providing sufficient access for our patients. I'll give you an overview of the solutions we implemented to improve our situation and provide a first look at some of the results we've seen. Dartmouth-Hitchcock Health is New Hampshire's only academic health system and serves 1.9 million patients across New England. The health system includes a 396-bed flagship hospital in Lebanon, New Hampshire, and 4 affiliate member hospitals, as well as a visiting nurse association. In terms of annual statistics, the numbers may seem small for a health system, but are relatively large for our rural setting. So to give you some background on why we embarked on this access journey, Dartmouth-Hitchcock Medical Center, our flagship hospital, was turning away 200 to 300 acute inpatients each month due to capacity constraints. These were medically appropriate patients, some who needed tertiary care, that we had to send to other hospitals, which meant they had to travel sometimes hours to get care that they should be able to receive right in our community. In addition, many of the outpatient clinics had long waits for patients to get appointments. In 2020, we decided to partner with a consulting firm on an initiative called Throughput Access for Patients Project, also known as TAP, to reduce the inpatient length of stay and create better outpatient access for our patients. Potential benefits of this project were 65,000 additional visits across the system and a reduction in length of stay of half a day, resulting in approximately $32 million in net benefit over 18 months. The focus of this presentation will be on the work done in the inpatient space. Although there were a number of recommendations that came out of the consultant's initial assessment, one of their major recommendations for success came around data reporting and accountability. My team, the Analytics Institute at Dartmouth-Hitchcock, partnered with the consultants to develop a suite of reporting tools to support the initiative. In order to identify opportunities for improvement and measure performance, data needed to be easy to use and accessible to all stakeholders. Standard weekly reports with key performance indicators by unit were pushed out to unit leaders every Monday, but staff also had the option to go into an analytics application to drill down on specific measures and manipulate and view data in multiple ways. Senior leadership was anxious to start seeing results, so the team worked in 2-week sprints using an iterative and agile process that enabled them to quickly share their work and get feedback from the consultants and other stakeholders. The heavy lifting outside of programming and development was really around getting consensus on the business definitions for the 40+ metrics that were requested. We worked closely with the consultants and the clinical and operational leaders to make sure we were capturing actionable data. Resources were provided to leaders to educate and coach them on how to understand and interpret the data. I wanted to at least share a screenshot of one of the applications we built. This is just one of the 8 tabs in the inpatient application. All are set up the same way, with filter options on the left-hand side of the page and then either tables or graphs in the remaining space. We also created subtabs to organize the metrics by subject matter. One of the many benefits of this application is it allows the user to look at summary data, but then have the ability to drill down to identify specific providers, staff, or patients that may be contributing to negative performance. This is a screenshot of the standard weekly unit report that we push out to leaders each week. This report is drawing off the same database that the analytics application is, so all of the data ties and there is no confusion as to which metric value is the right one. Creating these tools alone would not have been successful without creating a culture of data-driven accountability to support them. The unit managers, hospitalists, and care management staff met weekly with physician and nursing leadership to review unit summary reports to assess performance on key metrics and discuss major challenges and determine action steps for improvement. These teams also held patient progression meetings monthly with hospital senior leadership. All participants would come prepared to address progress and any barriers in their respective areas using the TAP application. A follow-up log was completed during the meeting. All action items had an owner, an objective, and an identified date for resolution. The results I'll share with you today were for the first few months of the project before work and all business as usual were interrupted by COVID-19. Once the teams began rounding regularly to discuss patient progression and placement, we saw length of stay drop from a baseline of 5.92 to 5.65. Enhanced communication between unit leaders, hospitalists, and care management staff also resulted in us surpassing our goal of 60% of patients being discharged before 2 p.m. This also enabled us to take more patients and reduce our capacity denials from 200 to 300 a month to an average of about 100 per month initially, although numbers climbed back up as COVID-19 limited the number of patients we could take in-house. All of these preliminary results have contributed to meeting our goal of better serving our patients in the community. In addition to these improvements, we saw an increase in the application user days, so we knew people were looking at the data. It was extremely rewarding to know that the tools we worked so hard to develop were being used and that they were making a difference in how we cared for patients. In summary, data is key to any quality improvement effort in order to track progress and identify areas of opportunity, but data alone cannot make a project successful. There needs to be a plan to integrate that data into workflows, set clear targets and expectations in order to drive outcomes and sustain organizational change. This concludes the presentation. Thank you.